Just let me know when you're ready for me to share my screen.
Okay, very good. I will. Hello and welcome everybody to our session on emergency preparedness and coping with crisis. My name is Ryan and I am the director of the VEDS movement. We are fortunate to have with us tonight two individuals who really don't need an introduction to the connective tissue community and especially the VEDS community. Two individuals that really work tirelessly to improve the lives of those living with Marfan, Loeys-Dietz, VEDS, and related conditions. Katie Wright, podcaster extraordinaire and former director of the VEDS movement, joins us tonight, as well as Meg Boglin, a steering committee member for the VEDS movement and clinical nurse navigator at Hope Hospital's Marfan syndrome and related conditions program. Very briefly, just as a reminder, if you have any questions for Meg or for Katie, those can be submitted to us through the Q&A function of Zoom. And if any of your questions are not addressed during the course of the next hour, you can always go to the Help and Resource Center at marfan.org/ask. Again, that is marfan.org/ask. And so with that, I will turn it over to Katie and Meg.
Oh, thank you so much for having us. Good to see everybody. Don't worry, I can't actually see you. I always say that. Okay, I'm sharing my screen. Can you see it? I'm assuming that, yes. Okay, I see a thumbs up. Thank you. So this presentation is on emergency planning and coping with crisis. I'm Katie Wright. Like Ryan said, I host the podcast Staying Connected, where I talk to people about their stories with VEDS or vascular Ehlers-Danlos, Marfan, and Loeys-Dietz, and similar conditions. And Meg, do you want to say anything more about yourself? You've been very, very active in everything.
Sure. Thanks, Katie. My name's Meg Boglin. I'm a nurse navigator for the Marfan program at Hope Hospital in Newport Beach. I'm also affected with vascular Ehlers-Danlos syndrome, as well as my two children. So I have many hats, both on the health professional side and on kind of a patient side, parent side. So we've got, I think between the two of us, we're hopefully experienced enough to share with you our insights for emergency preparedness.
Yes. Okay, I'll take it from here. I just want to share a little bit about my story. So the context I bring to this presentation is that I have VEDS or vascular Ehlers-Danlos syndrome. And VEDS is associated with several life-threatening emergencies, including arterial and aortic dissections and ruptures, hollow organ ruptures like the bowels and the uterus, and lung collapse, and other things like carotid cavernous sinus fistula, which is a big mouthful. So just a little bit about what I've lived through, just as I'm bringing this context to this presentation. I've had several TIAs or mini strokes, also known as transient ischemic attacks. I've had a spleen rupture, which we'll talk about in this presentation. And most recently, I had a renal artery dissection, kidney infarction, iliac dissection, and hepatic artery dissection, which I won't be talking about in this, but I want you to know these are things that can happen with VEDS, and this is kind of why I think about emergency preparedness. I was diagnosed with VEDS in 2017, and after my diagnosis in May, I had an emergency book. I had a necklace I was wearing that had my medical condition on it. I thought I was pretty well prepared for an emergency, but in December of 2017, I had a big transient ischemic attack in the middle of the night. It was about 2:30 in the morning, and I got up to get a glass of water, go back to bed. On my way back into the bedroom, I collapsed. The room was spinning. I couldn't feel my left leg or move my left leg. It's like trying to move a noodle. Had trouble with my right arm. And I realized I was not prepared for this emergency pretty quickly. I knew very quickly I was having a stroke, and I had to crawl 15 to 20 feet to my nightstand in order to get my phone, which was up on the nightstand. So one of the things that went wrong during this is that I couldn't get to my phone easily. I was also giving myself some immersion learning. I was learning Swedish on Duolingo, and I had my phone entirely in Swedish. So once I got to my phone, I wasn't confident that I could ask it to dial 911. So I was fuddling around with the keypad. I tried to accidentally text somebody. I dialed 941 a couple of times before I finally was able to get 911 on the phone. My neighbor had an extra key to the apartment. I thought that that was really good for emergencies. So when I finally did get the dispatch on the phone, I told them my neighbor has the key. This is her name and this is her apartment. And they didn't go there. So I had to crawl to the front door to let them in. And when they got there, I had to tell them where my emergency book was. Like the University of Washington had given me this nice book with all of the scary things that could happen to me. And I was supposed to have it on hand for emergencies, but I had to tell them where it was. It wasn't in a very obvious location or anything like that. I think it was probably in the pocket of one of my pants. So it wasn't really very good. So this made me start rethinking my plan. I started thinking about what ifs. And what ifs can be really, really scary to think about. These are the things that like make you worried with VEDS or Marfan or Loeys Dietz or any of these other conditions where all of this scary stuff can happen. We try to avoid the what ifs because what ifs are scary. We don't want to think about them. But I started thinking about the what ifs and trying to come up with solutions to them. Like, what if I had been unable to speak? What if I couldn't reach the phone? What if I couldn't tell them I had VEDS? What if my phone was dead? Like, I just started thinking about ways to solve these what ifs, or as many of them as I possibly could, so that I could try my best to let go of the rest. It's kind of that, control what you can and let go of what you can't. And started really thinking about these. And I will say I was having a lot of anxiety at this time, right after this TIA. I'm sure that you probably have been there after an emergency, or hopefully you never will be there after an emergency. But I was so scared that I didn't feel like I could take a shower because I couldn't bring my phone in the shower. Like, these were the things that I was dealing with mentally during this time and trying to come up with solutions for. So initially I applied for something called a premise file, which is something that you can apply for. I think in most cities or localities, they have something like this, where if you have one of these, if you call 911 from the address where the premise file is attached, then the first responders will see a little message. So it could say, Caitlin Wright at this address, subject to aortic dissection or something like that. So I applied for one of these. Unfortunately, it was denied because they thought the medical examiner believed that the first responders would get education and know all about this stuff. So then when it was denied, I was like, no one is going to tell me that the first responders can't know what I have. I'm going to make a door sign. Is it overkill? I don't know. At the time, it felt good. This was my first emergency door sign. I put it on the front of my door, and I think I put it on the inside of the door too. And it says, if you can't see it, Caitlin has vascular Ehlers-Danlos syndrome, high likelihood of artery ruptures, artery dissections, and organ ruptures. I really just wanted first responders, if they were coming to the house, to know, hey, there's someone here with the possibility of this stuff. Because when you look at me, especially at the time I was 28, I don't look like this stuff can happen to me. I thought it was really important that they know, so they don't dismiss anything as possibly, low blood sugar or something like that. I got a key box. I gave the fire department, just the one fire department that responded to my address, the code, so they would have it in case I couldn't get to the door. I didn't want them to have to break down the door. I examined a lot of fall detection devices, and I felt really icky about that, but I ended up with an Apple Watch, which felt to me like a good in the middle solution. Those do offer some helpful features, including the ability to call 911 from your watch. An emergency bracelet. The first responders that I talked to said, hey, you should probably have a bracelet and not a necklace. So I went with their advice and got a bracelet. I developed a phone tree for making sure that I didn't have to contact every single person to let them know what the update was. I made a tree where like one or two people I would contact, and then those people were assigned people to contact, and then it was off of my plate, because in an emergency, that's the last thing that you want to be having to do. And then I really started visiting first responders and educating them. And I found that every single time I did this, first responders were very, very happy to learn that this condition exists and that there's somebody in their jurisdiction that has it. As from my experience, they wanted to know as much as possible. So I've done this every time that I've moved, and I really highly recommend even just going down to meet them and giving them resources in case if you're not comfortable educating, giving them resources like a website, the VEDS movement, the Marfan Foundation, so that they can learn on their own. And then I learned that there are shortcuts I could have used. My iPhone, which was in Swedish, apparently if I had just hit the button on the side a few times, it would have automatically called 911 for me. It's like a SOS feature. So look at those features on your technology that you use. I think all of them probably have some kind of shortcut. So my spleen rupture in 2021 is when things really went better. I was outside getting a soda out of my fridge. I was living in a camper at the time. I had just moved to Seattle, Washington to be closer to my vascular surgeon. And I felt like I was internally bleeding. It was sudden onset pain, started feeling like I was going to pass out, like that cold sweat feeling. And I knew that that was associated with internal bleeding. So I called 911 immediately, told them I was internally bleeding and I needed an ambulance. And then I called my vascular surgeon, who called the hospital, and she had the resident there ready for my arrival. And then she called me back and stayed on the phone until the first responders arrived so that she could talk to them and tell them this is the hospital that she needs to go to. Somebody is waiting for her there. This is an emergency. It's most likely that she is internally bleeding, or, it's high likelihood, or whatever the language was that doctors use, that I am not one. So the emergency team was already kind of mobilized when I arrived at the hospital. It was the best case scenario. The resident even was there to keep pushing for a CTA scan. It took a little while because I was in line, but he said, "Hey, we really think she's internally bleeding. We need a CTA. We need a CTA." And he would come back all the time. "Did you get the CTA yet?" Very, very helpful to have that kind of advocate in an emergency. I did have internal bleeding and I was admitted. I always include this picture on the right-hand side for this presentation. This was several days into my stay in the ICU, and it was the first day I was able to sit up after all of this internal bleeding and having the surgery to coil embolize my splenic artery. So big deal for me. I was very happy to survive that close call. So I'm going to pass it over to Meg before we go on to our takeaways so she can share some of her story.
Hi, everybody.
Oop, okay.
So I don't really have a big slide, and I probably won't go into a lot of my emergency experiences, except to say that I was diagnosed with VEDS at 36 years old, but by that point had already had one life-threatening aneurysm, which required a few emergency trips to figure out what was going on there. A lot of being sent home with an actively growing aneurysm. And, a week later ended up having like emergency surgery. The one note I will say, if anybody recommends driving yourself to an emergency room, if you feel like you are, or even if you're in a lot of pain, if a healthcare provider or if anyone is suggesting drive yourself, just don't, and just err on the side of caution and call an ambulance. You'll get into the CT scanner faster anyway, which is what we all should probably be thinking if we think there's an emergency and we need a diagnosis quickly. So like I had said earlier, I was diagnosed with VEDS, but I'm also a nurse navigator for Marfan program. So I've got a lot of experience now, about 5 years of experience now working with Dr. David Liang in the Marfan program at Hoag Hospital. And the things that I will focus on are really how to prepare, kind of coming from the healthcare perspective, and what will be helpful for practitioners that are treating you in the emergency room, and how your own care team can help you prepare for these emergencies. So the first thing is talking to your care team. So hopefully everyone here has like a primary care doctor that is focused on their connective tissue disorder, probably a cardiologist or cardiovascular surgeon, but your go-to person that is managing your connective tissue disorder. Make sure you have their phone number. And when you have your annual appointments or your consultations with those doctors, get their input on what to do in an emergency at your local facilities, because they'll have good insight on the emergency room processes. And like Katie was sharing with her story, like having somebody kind of on the inside that can advocate for you if and when an emergency comes up is extremely helpful and timely with getting you when you are getting you the scans that you need, diagnosis right away. And so you're not sitting in a waiting room, because that can be deadly, to be honest, with these conditions. And so not going to shy away from the fact that these are rare conditions, and a lot of healthcare professionals aren't aware what these conditions are. Even if they say they've heard of them, they might not necessarily know what the appropriate emergency room diagnostic studies are. So if, we're in healthcare, we're kind of conditioned to just do an echocardiogram when someone comes in with chest pain. And so we should know for our conditions, we might want to skip that echocardiogram, because it's not a heart attack we're having. It could be a dissection that we're having. And so not all practitioners will know that, especially in triage areas, which is like, they're like the gatekeepers. And so there are certain things that will be really helpful for not just our EMS, like first responders, paramedics to know, but also in the emergency room. So already having certain information in your medical record can be very helpful. So just to go back, not miss anything on this slide, get the process or get the insights, kind of the inside scoop from your healthcare team on how to manage an emergency. And if there's any special numbers, like a Batman phone, like, super phone number to have, get that phone number, get those phone numbers, and then make sure somebody else that could be with you, a spouse, a caregiver, parent, has those phone numbers too. So if you're not able to call, someone else can call on your behalf. Obviously, 911 will be the first phone call. The second phone call will be your care team and that person that can kind of be your advocate in the background. Katie already mentioned like having an iPhone. Full disclosure, we are not like iPhone employee or Apple employees or anything like that, but smartphones and some of the healthcare apps that have emergency alert functionality is super helpful. So our electronic health records, I'm kind of a big proponent with using our electronic health records because that's one constant thing. It's data that's there that can follow you. So one important thing that we'll talk about later is something called a care coordination note. So in the Epic electronic medical record system, so most big hospitals in the country use Epic as their electronic health record. So if you have MyChart, that is the Epic healthcare system. There's functionality where your care team can add what's called a care coordination note, and that will follow you across all hospitals that have this Epic healthcare system. And so it can say, like what we do in our practice, we have a care coordination note that's specific to Marfan syndrome, specific to vascular EDS, specific to Loeys Dietz. And it will say it'll pop up when you're registered in the application, when you're registered in a hospital. If you show up in the emergency room, when you register, it'll pop up and say, hey, this patient has this care coordination note, and you need to be aware of this healthcare condition. Like, don't send this person home unless you've ruled out aortic dissection or a bleed somewhere, or fill in the blank. So that there's instructions that we'll go over later in this presentation to show how to get that into your chart. One good thing, or one critical piece too, is also updating your problem list or your medical history. So that's also working with your care team. Make sure that Marfan syndrome or that your connective tissue disorders is actually in your chart. it's funny how many times we go into the medical record and it's actually not listed as a part of the medical history. So that trigger is huge, because then a lot of doctors that do know these conditions will say, oh, this person has Marfan syndrome and they have chest pain, so let's get them to a CT scanner. And then I think I mentioned earlier using the smartphone apps. And then one thing that's personally been useful for me is having a go bag. So I have a bag that has my medical or medication list, change of clothes, and phone chargers in case I need to go to a hospital. Just so I have one for my kids and one for me. So it's right by the front door. It's almost like if pregnant women that are ready to go into labor, they have their go bag. We have a go bag for the rest of our lives, as far as we're concerned in our household. So anyway, just something that's been helpful. Katie, do you think? Okay. So this is something new that we haven't really discussed in this presentation before, but it is something that I think has been helpful. So this is, if you guys want to do a screenshot, but these are diagnostic codes or to have in your medical problem list or your medical record. So we want to have your actual connective tissue disorder diagnosed. So Marfan syndrome, LDS, VEDS, and that diagnosis code is what's called an ICD-10 code. So that's just kind of an insider, insider description, but these will follow your medical record. And so if you have these diagnoses in your record, then those are like red flags, triggers to indicate that, hey, this isn't what our protocols might say. This is going to lead us down a path of going, basically doing the appropriate diagnostic test that we need to properly treat you. So having history of an aortic aneurysm or dissection or a predisposition for having aneurysms is going to start that ER doctor thinking away from like, oh, this is not our standard heart attack. This could be something more not more serious, but it's going to go down a different route where the diagnostic tests like a CT scan are going to be more useful. So these are like red flags, triggers, and super helpful for us healthcare providers to know that these things could be a possibility, and we need to rule those things out sooner than later. Katie, back to you.
Thank you. My mouse disappears. I have trouble muting and unmuting myself. So I wanted to share some additional, kind of reiterate some of these basics that we've been talking about. One of the things that Meg mentioned was establishing a care team. I want to emphasize using that care team. When I was first diagnosed with VEDS and I got to meet my vascular surgeon, I was given a cell phone number and I was afraid to use it. You know, if you have never had that situation where you have a doctor's cell phone number and then they give it to you, it's like, you don't want to use it. You don't want to misuse it and have them regret giving you their number. And so even when that first big mini stroke, even though I had a mini stroke, I was at the ER, I went to the ER by ambulance. I didn't let my vascular surgeon know until I was in the waiting room and had already been triaged. And she was like, "What are you doing in the waiting room?" and called the hospital. But I was afraid to use that phone number. So I just want to emphasize, if your doctor gives you their number for emergencies, use it in emergencies. Like Meg said, they can call the hospital in advance, or there's all sorts of things that they might be able to do, especially if they're in the same kind of hospital network as the ER that you're in. And then, again, find those solutions to the what ifs. Meg listed a lot of them. We talked about a lot of them today. Educate your first responders, just think about it. And then one that's really, 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 really important. Know the signs of an emergency associated with your condition. In May of 2019, I fell down the stairs and had sudden swelling in one of my glutes, almost passed out, didn't think, hey, this is really serious, and got on a plane for 8 hours. So later I found out that it was a small artery rupture, and I had totally ignored it. Know the signs of an emergency associated with your condition. That could be the difference between, oh, this stomach pain is new and I'm just gonna wait it out and not think anything of it. It could be the difference between whether or not you get the care that you need or not. So I know that the VEDS movement does have the signs of a lot of the different emergencies on their website. I think it's on the emergency preparedness page. It's on, I don't know, I built the website, so it's there, I promise. And I'm sure Ryan can point you to it if you can't find it. Meg, I'm going to pass this to you to talk more about this.
Okay, so this link is leads to the instructions for how healthcare providers can add the care coordination note to your medical record. So this is something that you can take to your like your primary care doctor and have them add. And there's actually examples on the Marfan Foundation website and actually for the VEDS movement and Lois Dietz for specific information, like the critical information for other healthcare providers to recognize. So yeah, it looks like April Dawn is listing the link to the website. So that's fantastic.
Perfect.
But anyway, it's a very useful tool. In fact, it's not, it's editable. So what we've actually done for our patients, we've added our cell phone contact numbers. So Dr. Ling and I've added our cell phone contact numbers for not just the patients to have, but for the clinicians to use and be able to call us if they interact with our patients in an emergency situation. So this is something to take to your care provider. It's not something that you can add to your chart, like through my chart, but the healthcare doctor or healthcare providers can do it on your behalf.
Cool. And then I've also linked the emergency preparedness kits and cards that are available from the Marfan Foundation, from the VEDS movement, and from the Lois Dietz Syndrome Foundation here. So you can scan whichever, move my mouse, you can scan whichever one is, most relevant to you. And I believe that this is going to be recorded and aired later. So if you don't catch it now, it'll be up later on YouTube, I'm sure. But there's one for Marfan and related conditions, one specific for vascular EDS, and I believe that the Lois Dietz Syndrome Foundation has one very similar for LDS, or at least some emergency preparedness resources there. And then just a quick plug, the VEDS movement does offer free medical ID for people who are genetically confirmed with VEDS. This is a link to order one of those. There's some examples of them here of the 3 different types, and I know that they come in all sorts of different colors. But if you have vascular EDS and you're watching this, go ahead and order one. Thankfully, the VEDS movement got a really nice grant to be able to provide these. And then I believe, hopefully April or Ryan, you can put it in the chat. I believe that the Marfan Foundation has a discount code for Sticky J for getting medical IDs for generally all the conditions. I think it's Marfan 20 is the code, but I'm not sure. So if that still exists, please go ahead and put that in the chat. All right, so I guess we're going to move on to Q&A. Thank you so much.
Thank you so much. Both of you provided such wonderful and helpful information. I am going to pull up the Q&A. We do have a number of questions that came in while you were chatting. The first question is, do emergency personnel regularly check your cell phones for emergency information that you may have?
I think so. From what
I don't know the answer to that.
Yeah, I mean, I think it's becoming more common that paramedics are checking cell phone medical alerts, but I can only speak to the departments that locally that we've educated, that we've encouraged to check. But I think so. but I think it's worth a phone call to your local fire department and EMS services to ask and then say, hey, because I have this condition, what do you guys recommend? Like,
Yeah, I think that's I would like to add on that too, because I've lived in, somewhat not rural areas, but certainly less populated areas than Seattle. And, um, there was a time when I was using, Backpack had the QR code thing for emergencies. And when I brought it to the fire station, I said, hey, do you guys use this? And they're like, oh my gosh, we've never seen that before. What is that? And they were very, very excited to see it, but none of them had ever used it. And so I think it's a really important point that you made, is to visit your local first responders, see what they use and what they're used to using, and then kind of adapt your plan to that.
And there's a related question, and I'll direct this to Katie because you've been through this process, but do you have any advice for someone to get in touch with their local paramedics, EMTs, firefighters? Did you physically go to the responding station? So do you have any tips for someone that wants to?
Every time I've done it, I've showed up. I've always just showed up. But there are phone numbers listed usually for non-emergency emergency services, like to contact them. And so I've used those to follow up before, but usually I think the best bet is to just arrive. Unless you have like a volunteer fire department or something like that. I think you'd have to dig a little harder for the phone number and make sure that somebody is there. But that's the way I've always done it. And if it's not a good time to get a call, they say, come back later, come back on this day. And a lot of times they want you to come and visit every shift, because the way that they rotate shifts. So, if you visit on a Sunday, they might want you to come back on the Monday to meet the Monday, Tuesday crew, because they'll be back Wednesday, Thursday. They just switch off. So, knock on the door, bring cookies if you want, show up.
I've called and talked to our local EMS phone service because it's an outsourced like 911 dispatch company. And so I had them they basically put notes on our address and said, hey, there's 3 people at this address that prefer to go to this hospital, which is like not a sure thing. You can always say what your preferred hospital was, but it really depends on what the situation is to determine if you'll get there. I mean, I've been in emergent situations where I was like, just get me to the closest hospital and we'll deal with transfers later if we have to. But you can just call your local city, local services, EMS services, to get more information about how to educate them about your condition.
And do you have any tips with regards to preparing for that conversation to make sure that it's the most effective conversation that you can have with them?
Can I go first?
I'll
go first. Okay, so what I usually do is I print some information off the VEDS movement website and I bring that with me. So I bring a copy of my emergency card to help, it's in the emergency kit at the bottom of the kit. I know it's in the Marfan kit and the VEDS kit. I bring a copy of that because that's kind of a good guide for these are the most important things that the first responders need to know. And even if you're not very familiar with those things, that can just help, hey, I have this rare condition and I don't know what any of this means, but it's serious, right? And let them read it. Let the paramedics figure it out. There is a first responders quick guide that was developed by the VEDS movement with Morgan Joswiak. And that is available on the VEDS movement website. And that goes through the different areas in the body for VEDS that can be affected. I know a similar page is also existent in the emergency preparedness kit for the VEDS movement. So those links that April already put in, or the links that you scanned on your phone, there's a couple pages in there specifically for the signs of the emergencies associated with VEDS. And I think that's also applicable for Marfan and Louise Dietz too. So good page to print out, bring it with you. And that will help them, even if they don't know, if they look at it and be like, wow, what is a pneumothorax, which is highly unlikely, they'll probably know what it is. But, it'll be in that kit, and so that they can kind of look at it I would say those are the things that are most important to prepare. And maybe, you know, if your doctor's on board with this and they are happy to talk to the first responders about it, bring their phone number or their contact information for their office. And that way there's an extra person there who's willing to talk to them. Follow up, you know.
Meg, do you have anything to add?
I think Katie is like an excellent resource on this part. I think I can speak more to the what to do in the emergency room and
Sure.
get prepared for that.
I think that there should be a whole other webinar on navigating the hospital once you've had an emergency and you're admitted. I think that would be a good one for the future.
Note taken. So a question for you, Meg. Are there any less severe signs or symptoms of an impending dissection or rupture to look out for and have checked out before it reaches an emergency situation?
Well, I think, we would do annual screening. This is, I mean, for most of these conditions or all of these conditions, active surveillance to know if there's anything potentially dangerous, I guess, for lack of a better term, is really important. And so you kind of have a heads up in any particular area that may be of concern. I mean, Marfan syndrome, you want to have that at a minimum, annual echocardiogram, right? And know your measurements of your aorta. If you've got other, you know, some of the other conditions where the entire vascular tree is affected, you want to know where you might have some dilation somewhere. But really just be aware of what are signs and symptoms of pain, or a dissection. So pain, loss, basically what happens when there's dissection, it's lack of oxygen getting to where it needs to be. So one of the first things we experience is pain. You can have numbness, tingling, lightheadedness. All of these things really should be discussed with you and your care provider, but they're always good to know. I mean, there's lots of really good information on the Marfan Foundation website, and then the, you know, related conditions website, so the VEDS movement and the LDS page. So I definitely encourage everyone to go and know what the specifics are. But for the most part, I think the straight up answer is pain, discomfort, nausea, like not feeling, just that gut feeling that something doesn't feel right. Trust that instinct and make that phone call to your care team or just 911. Unfortunately, we live with conditions that it's better to err on the side of caution and get evaluated sooner than later. So I think what Katie was saying is don't hesitate to use that hotline number if you have one to a doctor that understands the conditions, and they give you their cell phone number to help you work through those questions like, do I go to the ER? Do I not? What do you think this could be? You know, that's something to talk through with your provider. I hope that helps.
There's a comment that EMTs are frequently trained to look on the refrigerator for medical instructions as well.
Mm-hmm.
And so my comment would be don't hesitate to make multiple copies and have information in as many places as possible. So I don't know if you have any further suggestions to make sure that that information is readily accessible.
Yeah, make copies. I think make copies is a great thing, and got a PDF too, you know, that you don't have to carry it around with you. If you're, I'm not one for the big emergency book to carry everywhere. So I have the wallet card and, you know, like information on my phone that I can easily pull up. But, you know, find what fits for you. Think about when you're moving around, like when you're outside of the house, you know, but definitely having multiple copies is helpful. And I would say based on my recent experience in the hospital, make sure your family members have that information too, and they know what to do. I think that prior to that, you know, we really relied on a lot of my knowledge and experience, and I really needed help this time around. So don't forget that even if you're the most knowledgeable in your family on your own condition, you know, don't forget to educate your family members who might be there helping in an emergency too. they need stuff written down. It's good. It's a
One
good
thing I'll add as a parent too is having even like a laminated postcard or something to like stick in a backpack or an overnight bag for kids to not have a binder to carry, but maybe something. I mean, it's nice having QR codes nowadays for easy access to information. Having the kids wear medical alert bracelets. For my youngest, what we've done, because I'm still fiddled with bracelets and things like that, they have the medical alerts that actually go on Velcro shoes. And so not just so anyway, it's nice, it's convenient, it's not lost easily, but it not only does it have my phone number, it's got our doctor's phone numbers also.
Can I ask a follow-up question? As if I was in the Q&A.
Absolutely.
Meg.
Of course.
So you were talking about putting information like in a backpack or making sure the kids have the medical IDs. How do you think about like what information is on those medical IDs that could scare a child? Like at what point, like what do you have on your kids' medical IDs that's different than yours, or is it different?
It is different because I've tried to put my own, like I use medical terminology so I can fit it all in like a little space for me. But basically that's a great question. And there's a lot of discussion, and I've been asked what's on your medical alert bracelet, and I can read it right now. But so mine's on my watch band because I don't wear bracelets. But basically on my own medical alert, I say, personal history of aneurysms, dissections. On my kids, it says predisposed or, risk of dissection. And this could be a whole other topic or a whole other workshop as far as talking to your kids about, these types of conditions and how to manage. And we're all different parenting wise. But for me with my kids, I really just go with what's age appropriate for that kid. I've got a boy and a girl, so maturity wise, they're way off anyway. Even with relation to age, they're still way off. So, but I do educate whoever their caregiver is or whoever they're with. So my close friends know what's going on, that will watch my son. My daughter is old enough now where she can self-regulate, self-manage. So does that answer your question? It is different for each
Yeah.
kid and for like information that I provide for caregivers because the caregivers do freak out. And I just say, if you have any questions, just call me. We'll talk about it. So I give them the paperwork and I say, read this. It's going to scare the lights out of you. But when you're done reading it, let's have a real conversation. And then, just call me with any questions and concerns.
Yeah, it definitely answers my question. And I see that April suggested a future topic. Stand behind that. I think it'd be a great webinar.
Yes, I love the idea. We are running low on questions, but we also have a bit of time left here. So if you have any remaining questions, please do submit those via the Q&A. The last remaining question that I have here currently is, I've had 2 dissections, including one of the ascending aorta, and did not feel any pain. And they go on to say that those were actually identified just during their routine imaging. And so are there any other signs that they should have been looking for to be aware of the fact that they had experienced dissection?
I want to go pull David Liang in the office and ask. Dr. David Liang anyway. I have dissections that were diagnosed through imaging later. I didn't even know that I had. It would have been nice to know that I'd had them. Actually, might have gotten me diagnosed sooner than later. So I understand. I guess my thought on the matter, I guess from my personal experience, is that thank God they weren't that bad enough to not have any other symptoms. I mean, I feel very lucky to have survived dissections that I didn't even know that I had. But what was there to look for? I think what's important is that once it's been identified, we still need to keep our eye on it, because dissections can change into aneurysms. And so knowing that they're there is, after, once you know they're there, that's important. And then from that point, it's continuing monitoring those spots, potential hot
Yeah, I'd
spots.
like to second that too. Like I've also had a the hepatic dissection was asymptomatic. It was diagnosed on follow-up imaging for my renal dissection and my iliac dissection. So once you know, but just a reminder that like if it's not painful and you don't know, and hopefully it's something that just gets caught on that surveillance imaging that you're getting for your condition. And it goes back a little bit to like, you don't know what you don't know. Like you just can't, some things you won't be able to control. And I wish that I could look into a mirror every day and get like a little like, your arteries are good today. Nothing's changed, but we don't have that technology yet. Maybe it'll be in the future. I sure hope. Doubt it, but it would be great to know that. But you can only do what you can do. And, responding to, reacting quickly to pain that is new and severe and symptoms that are new and severe and indicating that there might be something going on is really like that, combined with surveillance and medications that your doctors prescribe and everything else your doctors prescribe. That's the best that you can do. So it might not be 100%, and that's okay, but you got to do the best that you can do.
I do have a follow-up comment. It seems the person that commented about checking the refrigerator in EMT training was driving at the time. And so they now have a little bit more information to share now that it's safer to do so. And so they had said that in their knowledge, first responders are typically taught to check the wrist first, and then the refrigerator second, especially if the patient is unable to speak. They will check a phone if that phone is physically near them someplace, but won't spend a lot of time hunting for one. And then they're also taught sometimes to check the front door and next to the bed. I have a couple of questions that came in that are very similar. One is with regards to any special preparations for emergency preparedness that can be made while traveling. And then the second one specifically asks about traveling internationally, but those are both very related questions.
Do you want me to start, or do you want to start on?
You start, and then I'll add on to it if I have to.
Sure. So one of the amazing things about being part of a really growing community, national community, international community, is that a lot of times there are people within this community who live in places different than you. And, one of the things that has been really helpful is like if you're part of a group, or if you want to reach out to the Marfan Foundation Help and Resource Center, you could say, hey, I'm traveling to this place. Anybody live there? What doctor should I contact if I have something? Or where do you get your care there where you are? And that can help guide you. And that applies nationally and internationally. There's a big center in France for VEDS. There's people in the UK. I mean, there's people all over the world with these conditions. And the Marfan Foundation will also have a list of centers, around where you might be going. So check out those resources before you go. Ask people if you feel comfortable with it, but it could be really, really helpful for knowing like who to call. And then if you want to call in advance, say, hey, I got your number from this so-and-so, and I have this condition and I'll be traveling, can I use you as an emergency resource? I've never done that, but there's just knowing where those centers are, I think is helpful. Do you have anything to add, Meg, to that?
The only thing I would really add is if you're going somewhere and like visiting family, for example, you can ask family. They might say, oh, go to this hospital, or we go to this hospital. But for our conditions, I would recommend going to a trauma center, like just because they'll have this surgical resources that a local community hospital might not have. So if you have time to do a little bit of research beforehand, I'd probably stick with, and I would say from a priority standpoint, where to look, definitely check the Marfan's institutional directory, because we know that they're legit. And then from there, I would go trauma center over like a smaller community hospital, because most likely they will have like the surgical capacity.
I had a question come in, and Meg, you had commented on the fact that you have a wristband for your watch that has the medical information on there. Is a first responder equally likely to check your watch band for medical information rather than having a separate medical ID?
So my wristband has like a big like Caduceus medical alert icon on it. And so I hope so. I mean, I tattooed on my wrist too. No one ever looks at that though. That was a swing and a miss, but still, it's okay.
I recently, when I met the first responders locally to me, I asked them, hey, by the way, I recently switched from a medical ID to having my medical ID like on my watch. Will you see this? And they said, oh yeah, we'll definitely see it. So when you go and meet your first responders, ask them what they look for, and, you know, make sure they know that it's on Apple Watch bands or, you know, other smart watch bands. But it's definitely better for me. It's not been clanging around so much.
Katie, you had brought up the fact that we have a discount code, and I did some hunting to make sure that I had it correct. And so I will mention that really quickly. But again, our grant funding is for those that have a genetically confirmed VEDS diagnosis, and those medical IDs can be ordered through our website. But if you have a related condition, there is I believe it's a 20% discount. And the website is StickyJ, so StickyJ.com, StickyJ. And that is good to know because the actual discount code is Marfan and then SJ, like Sticky J. So Marfan SJ20.
I haven't bought a new wristband in a while, but I found mine on Etsy. Like there's a ton of Etsy shops that do personalized like silicone wristbands for all smart watches. So you can find anything on Etsy nowadays.
Someone had commented, if we have time, I would love to hear more about specifically what should be on a medical alert bracelet or necklace.
There is a guideline on the VEDS movement website for VEDS, and I would say it probably applies to Marfan and Loeys Dietz. You know, just take out the ones that aren't associated with your condition. But that is part of the emergency preparedness information from the VEDS movement. So let Ryan put that link in there, or April put that link in there to that page. Just know it exists.
I can do that. And then in addition to that, to personalize it a little bit more, in addition to those medical conditions that someone with VEDS might be facing on a trip to the emergency department, we also will put in a phone number for someone's, in case of emergency contact, as well as any medication allergies they may have, and things that just anything that an emergency department would need to know with regards to providing you the best care.
Yeah, good point. I think that it breaks out all of those and abbreviations and stuff that you can use for, you know.
So to add on to the information that emergency room departments will need to have, if you can already have it in your chart, that's really the most ideal scenario. So if you have like my chart or patient portals where you can add your own information, and that's just going off of if your care team hasn't already done that, you can add those things yourself. So then the emergency department doesn't have to look for it. It's already there. I mean, that's in an ideal situation where you're going to an emergency room that's within your care network. But yeah, and then worst case, not worst case, but the medical abbreviation and like a very strategic bracelet verbiage is key. It's helpful.
I would like to add something that I forgot to add earlier when you were talking, it came up in my brain. We've talked a bit about, or at least referenced a bit about care teams in this webinar. And I know that conferences here didn't include, creating a care team for VEDS. There was a webinar for creating a care team for Loeys Dietz, I believe. But there are resources available through Marfan and the Marfan Foundation, the VEDS movement, and the Loeys Dietz Syndrome Foundation, I believe, on developing a care team. So if all of us talk about like care network, care team, care provider, if this is all like, I don't have anybody, then I would recommend going and looking at those resources to help kind of guide you, and always marfan.org/ask. The nurse there, they have a list of all the different institutions that the Marfan Foundation knows are familiar with these conditions, and they can help you if you are lost.
So if there wasn't a workshop for VEDS, but the workshop for LDS was recorded, it would probably benefit anyone with VEDS to just watch the LDS one.
Yeah. And there's an old one on YouTube too, I think, for VEDS with Peter Byers as well.
As we start to wind down, I think just two more questions, and they're related to one another. One is, do you think it would be of benefit to put the actual ICD-9 or diagnostic codes on an emergency bracelet?
I think so, but I am a data nerd.
Yeah, I'm over here like, I don't know if that would be useful. I think that when there's only so many lines, if it's between that and allergies or aortic dissection, I would choose those things of my personal thought.
Yeah. So the reason I probably am more sensitive to it is in the VEDS world is differentiating between hypermobile type of Ehlers-Danlos versus like VEDS, because there's even in the medical community, there's still a lot of confusion between the two, and they are definitely not equal in an emergency situation. So that's why my instant response was, yes, I think we should have that, but it's just my own probably bias.
Now, as a complicating factor, there is not a specific code for Loeys Dietz in ICD-10. So I know that that's something that we are working toward, but it is a very generic code that actually encompasses other conditions as well currently, as far as I'm aware. Meg, I haven't been in practice for a few years. ICD-10, as far as I'm aware, is worldwide universal coding. So someone had asked about those codes being appropriate for use in Canada as well.
I think so, but the one thing that the caveat that I'm not sure about is the description. So the code could be the same, but the description, like the name, could be different. So I would just double check. But they're supposed to be universal.
I believe so. Yes.
Yeah.
And then let's see here. Well, this will be the final question, and as we run out of time here, thank you so much for your time tonight, and thank you for everybody for joining us. It's been a very important talk, and you've provided such wonderful practical advice, I think, for families living with connective tissue conditions. And so finally, and again, this is more of a medical question that I think that I'll still steer toward Meg. What types of dissections allow for the most time to seek care? And my bias is, if you feel like you've had a dissection, don't mess around with time and just go. But if you wanted to respond to that question.
It's a very complicated question to answer because it's extremely dependent on the vessel size and location. But really, if we think just basic anatomy, blood carries oxygen to our vital organs. And so if we aren't getting oxygenated blood to those vital organs, then those will eventually not work. So brain, heart, lungs, kidneys, like those are pretty vital. Can't live without those. The aorta is the largest artery of the body. There's a tear in the aorta. I mean, especially a complete tear through all the walls, that's extremely critical, life-threatening, not a lot of time there. So I mean, when in doubt, you seek treatment, whether it's, I don't know how many times I was, I thought a dissection was gas pain until, I thought it was gas pain until it didn't feel like normal. So that's why when in doubt, go get checked out. And if you have that gut sense that something's just not right, you don't feel good, go get checked out quickly.
And try to let go of any guilt that you might feel if you go to the emergency room and they don't find a dissection or something. Try to let go of that guilt. It can be very, very difficult. I mean, you don't want anything bad to happen, but I've been in many situations where I felt like, oh, it was a false alarm. I don't want to be the boy that cries wolf, but you really, like Meg said, I wouldn't mess around with these. Like this, it's your life that you're talking about or your child's life. And if you're really not sure and you're uncertain, it is better to err on the side of caution rather than find out it was something really serious and didn't react to it quickly.
Could not agree more. So again, Meg, Katie, thank you so much for your time tonight. This advice has been so wonderful. Again, if you have a question that was not addressed during the webinar, please reach out to us at marfan.org/ask to our Help and Resource Center. And again, thank you all for joining us. And Meg and Katie, thank you so much.
Thank you, Ryan. Thanks, Katie.
Thanks, Meg.